Edna, what do you
I'm saying, good morning. I'd like to call the health services to order on this 22nd day of March. Before we get started, I'd like to welcome Supervisor Steck to our committee. We all look forward to working with you. So we're glad you're on board. Okay, so first item on the agenda, we need to approve the minutes of last month's meeting. Supervisor McDevitt, seconded by Supervisor Smith. Any additions or corrections? All right, all those in favor? Aye. Oppose? Carried. Thank you. Okay. Rob, how are you?
Good.
It's
Good
good
morning.
to see you. Thank you. Okay, I'll turn this over to you.
Okay, I have two items I'd like to bring forward. The first one is a request to amend the 2023 Warren County budget in the amount of $360,000. This is to allow for acceptance and pass through 100% state aid funding from the New York State Office of Addiction and Services for the Addictions Care Center of Albany. This funding is for them to develop a men's residential treatment center. We purchased a property on 68 Quaker Road. And have been renovating that. It's going to be 22 beds for men's treatment.
Okay, would someone like to bring that motion to the floor? Supervisor Bruno, seconded by Supervisor Runyon. Any questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
Okay, second item is request to transfer funds from the unexpended fund balance. Pay court ordered criminal procedure law 730 competency examination and restoration expenses. I believe 50,000 was budgeted in this line for 2023. However, for our January invoice that we received, we had two individuals who received services, and we're already at an invoice at 69,585 just for January.
So we could be looking for quite a bit more for the rest of the year then.
Could be substantial as the year goes on. I looked at it on our tracking. We haven't received invoices for February and March yet, but in our tracking, it looks like we're probably at about 205,000 year to date.
Wow. Okay, would someone like to bring that motion to the floor, please? Supervisor McDevitt, seconded by Supervisor Runyon. Any questions? Yes.
Thank you, Chairwoman. Could you explain to me what exactly this does, this program? I think I know, but.
So what these are if the defendant is if there's an issue raised about their competency to stand trial, and that's whether they understand the charges against them and they can assist in their own defense. Those are the two kind of standards that are in question. So what happens is the court orders an examination when that's called into question. And then two examiners have to examine the individual and form an opinion. We pay $165 per exam. So that's part of what comes out of this line as well.
Right.
However, the substantial expense comes is that the person is found to be not competent and they have felony charges. What happens is they go to a state hospital for restoration services. And those restoration services are charged to the county at about $1,000. The individual typically can be in there 60 to 90 days is sort of a typical restoration, but sometimes people will linger in there and it can be even longer.
So I understand. So the restoration is getting them to a competency level that they can
So
participate.
they come back and face their charges, yes. Because that's what will happen. Basically, restoration is kind of like a curriculum. And they go through, they're also providing some treatment, for the individual because maybe they need, medications to assist them or something to help in that process. But they go through a curriculum where they kind of learn about the court process, the judges, the role of the judge versus the attorney versus the defense attorney. Go through some kind of like curriculum training that way.
Sure. And what did we have budgeted for this?
50,000.
That was it?
Yes.
That's what I'm saying. Sorry.
That's why we said,
Really, in my opinion, I think we ought to take, a view of maybe an average of the last 2 or 3 years.
Right. Something that,
And that was raised during the budget discussion. But
I recall that.
Start with 50 and see.
Thank you very much.
yes, thank you. Any other questions? I will vote on that then. All those in favor? Aye. Opposed? Carried. Thank you. That's it, Rob? Any other questions for Rob from the committee? Any questions from the audience? If not, then we're done for today. Thank you, Rob.
Thank you very much.
You're welcome.
Morning.
Good morning. Oh, you have some paperwork for us?
Just a little.
Oh, good, great.
Changed our agenda 6 times.
Oh, I know that.
The greatest.
Thank you. Thank you.
I got two.
Thank you very much.
Good morning.
Thank you very much. Thank you, Jim.
So it's different than what I have here.
It's been
We added a resolution request number 10 and attachment 20.
Okay, thank you. My goodness.
Sorry, thank you.
And Janelle, you are aware now that Hillary Steck is on our committee, so you're
Yeah.
welcome
Hey,
her.
Roger. That was one of my changes.
Oh, that's great.
This is the new one. Thank you. He takes chairs. Yeah.
We're ready whenever you are, Janelle.
Hi, good morning, everybody, and welcome to Supervisor Steck. So our first resolution request is to authorize a request or contract with the Defoe Family Farm to provide fresh produce throughout the growing season and frozen items and storage crop for the winter months, not to exceed $3,000. This produce will be utilized by participants to introduce new healthy food options to be used in healthy recipes. Health Services is utilizing their Adirondack Health Institute Healthy Communities remaining grant funds to cover the associated costs to promote healthy food storage, preparation, and cooking for participants.
All right, would someone like to bring that resolution to the floor? The motion, Supervisor Runyon, seconded by Supervisor Geraci. Any questions? Supervisor Bruno.
That seems pretty cheap. $1,000.
Well, it's 3,000.
Or 3,000.
Yeah, 3.
Even 3,000.
And we're using existing money, but it helps the farm because they have excess.
Yeah.
And then it helps our participants.
Mm-hmm.
We had a similar agreement pre-COVID that we were using funds for. And that farm has folded, so we needed to find a new farm to continue the program now that we're able to have our clinics in person, and now that hopefully we'll have some good fresh.
Seems reasonable for the whole season and you get what you need.
Yes.
Thank you.
Okay, let's vote on it then. All those in favor?
Aye.
Opposed? Carried. Thank you. I think that's a good program. All right, the second resolution.
This is authorized filling a vacancy and the request referral to the Personnel Committee to fill our vacancy of our health educator 2 full-time position, which is a grade 14 with an annual salary of $51,356. At the time I wrote this, the vacancy was anticipated March 14th of 2023 due to a resignation. However, it now is vacant. Health education is one of our mandated programs through our state aid Article 6 funding. This position is eligible for up to 36% state aid reimbursement.
All right, would someone like to make a motion? Supervisor Geraci, second by Supervisor Smith. Any questions regarding that resolution? All right, now let's vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
I'm very excited about this resolution request. Number 3. This is to authorize a contract with Health Research Institute and New York State Department of Health to accept strengthening U.S. public health infrastructure, workforce and data systems grant funding in the amount of $552,826. It'll be divided annually into about $565. The grant goes from December 1st of 2022 through November 30th of 2027. And we're looking to authorize additional funding and grant period extensions as needed if those become available. This grant is going to be providing funding to address longstanding weaknesses due to the chronic underinvestment in New York State's public health system. The grant funding can be utilized for strengthening the public health workforce, supporting retention and recruitment of current effort, making upgrades to the workplace and to increase employee satisfaction, providing public health training, and providing public health support services to our public health department. Some initial thoughts include recruitment, retention, workspace upgrades, and a carport for the cars. All expenses must have to be approved by the grant before we can utilize them and then get reimbursed.
Okay. All right, would someone like to bring that motion to the floor? Supervisor McDevitt, supervisor by Supervisor Bruno, seconded by Supervisor Bruno. Any questions regarding this? Supervisor Gary.
Federal funding or state funding?
Got notification from the state, but my understanding is the CDC probably provided money to the state to be distributed to the local counties. And one of the good things, I was at a NYSHA meeting last week and we're asking for it in yearly allocations. And if we don't spend the whole money, it'll go into the next year. So this is great.
Oh, that's good.
Our office is in dire need of some revamping and
Oh,
refreshing and renewing.
I think you're right on that one. Yes, so great. All right, all those in favor? Aye. Opposed? Carried. Thank you. We'll go on to resolution number 4.
Resolution number 4, request is to amend the 2023 budget to accept $552,826 from the grant that we just discussed from HRI and New York State Department of Health for the strengthening U.S. public health infrastructure, workforce, and data systems grant. And if you have questions, Tom's here.
All right, let's bring it to the floor first, and then if we have any questions, Supervisor Smith, second by Supervisor Runyon. Any questions regarding this? No, we're all good? Okay, then let's vote on that. All in favor? Aye. Opposed? Carried. Thank you. Resolution number 5.
Okay, this is actually to amend the 2023 budget for health education, and this is related to our resolution request number 1.
All right, someone like to make that motion? Supervisor Runyon, second by Supervisor Smith. Any discussion? No, if not, we'll vote then. All those in favor? Aye. Opposed? Carried. Thank you.
All right, this next one is to transfer funds in the 2023 budget, and I'll defer to Tom.
Yes, attachment number 6 is transfer. Our first transfer is for our ComCare, that most of the salary was in full-time and we're finding it was really part-time. So we're moving $7,000 there. Fringe is all the same. And then the second one is to transfer for our early intervention program to health services because we have our family help. We have 2 staff members that are working in this grant, the Children's Special Health Care Needs Grant. So their salary is budgeted over here and I just have to move it because we're utilizing it in the grant. So I've got to move that over for the year. And I noted that for both salary and fringe.
All right, we made the motion, right? Okay, no. All right, would someone like to make the motion for that? Supervisor Runyon, seconded by. Who that second one, who made the second? Oh, Dan, I'm sorry, second by Mr. Bruno. All right, all those in favor? Aye. Opposed? Carried. Thank you.
Okay, resolution request number 7 is to authorize health services to contract with therapists and other service providers to provide services to health services home care patients at the approved rates with automatic renewal unless there's a 30-day written termination notice rendered by either party. Health services and our home care agency is desperate for therapists and other service providers. Therapist visits are revenue generating because we're able to bill insurance. And by giving this resolution, this will expedite our onboarding process with the therapist if we don't have to come up with each individual therapist. As you know, we already contract with a lot of therapists, the same template that we utilize, whether it be speech or PT or OT or nutritionist or social worker.
That makes sense. Yeah. All right, would someone like to bring that motion to the floor? Supervisor Steck, seconded by Supervisor Runyon. Any questions on that particular one? All right, if not, then let's vote on. All those in favor? Aye. Opposed? Carried. Thank you. We'll go on to number 8.
This is to authorize a contract with the state health department to receive immunization action plan grant funding in the amount of $164,045, which will be distributed annually at $32,809 for the grant period of April 1st, 2023 to March 2028. And that actually would go to March 31st of 2028. And also authorize any future amendments to receive additional funding or grant extensions should they become available. The IEP funds of this grant are used to promote and support immunization related outreach, education, and clinics. We serve as a resource for providers, daycare, schools, camps, and the general community.
All right, would someone like to bring that motion to the floor? Supervisor Geraci, seconded by Supervisor Runyon. Any discussion? All right, if there are no questions, all those in favor? Aye. Opposed? Carried. Thank you.
I'll defer to Tom for the resolution request number 9. It's related to number 8.
Attachment number 19 is just, because we just got notified literally yesterday about the IEP grant, the new one that's going to be effective April 1st.
Right.
It's $525 more than last year.
Oh,
So I
okay.
just have to amend the budget by the $525. That's attachment 19.
Okay, someone like to bring that motion to the floor? Supervisor Steele, seconded by Supervisor Bruno. Any discussions? All those in favor? Aye. Opposed? Carried. Thank you.
Our last resolution report or request is like a repeat. That seems to be like that thing that keeps coming up. This is to authorize new contracts and/or amendments with current existing contracts or agreements with electronic medical record vendors. And right now, our one we're getting out of is Alaya Care. The one we're getting into is Home Care Home Base. So we have to be covered for at least those two. To include interfaces with Medicaid insurers as needed to ensure the electronic visit validation is in place to comply with the Medicaid billing regulations that went into effect January 1st of 2023. So effective January 1st of 2023, as you might have known from our November board health services meeting and the December board meeting, because the resolution 717 of 2022 was passed. We're required to have EVV to be able to bill Medicaid. What we're finding is each Medicaid insurer can use a different aggregator. And in order for the electronic, which is like an electronic billing clearinghouse, so each Medicaid insurer could potentially have a different aggregator, creating need for an additional interface with the medical record of which we have to pay for. So usually there's like an initial charge to that,
Mhm.
and then there's a monthly charge. Right now, we're having to ask for a second contract for EVV services with our current electronic medical record vendor for a second aggregator. So in your attachment number 20 is a copy of the resolution 717 in addition to a request from the company telling us that there's another aggregator and another need for this, so. I'm trying to make this as general as possible in case we get a third insurance company that are Medicaid. So just how this applies, like we have a census of around 50 in our home care. We have 6 current Medicaid patients. Each Medicaid patient potentially could have a different managed Medicaid insurance.
Oh.
And each insurance company potentially could have a different aggregator.
Mhm.
So when we first set the EDV up, we set it up for one aggregator,
Right.
not realizing that this would like snowball. And other home care agencies are facing the same thing. I was on a home care association meeting yesterday. And this was discussed, and we're gonna try to advocate for Medicaid, since it's their requirement to
Right.
either start helping to compensate, start helping to increase the revenue, reimbursement for us, or at least to require the EMR vendors to only charge once, or to require all the Medicaid vendors to use the same aggregator. I mean, there's gotta be
right.
some relief, but right now we're caught in the pickle and need the flexibility to whenever we get a new insurance company to be able to add that interface. So that's why this is written very loosey-goosey.
Understood. Huh. I don't want to be in your shoes dealing with that, I'll tell you that. All right, someone like to make a motion on that, please?
Yeah.
Supervisor Geraci, a second by Supervisor Bruno. Do you have any questions for Janelle on that one? It's like, wow.
Yes.
What's the likelihood of any streamlining, so to speak, of this? I mean, I know it's a tough question at this point, but
One of the sticky wicks for us right now is we're trying to transition out of our current medical record and go into the new medical record.
Right.
We're still waiting for all the contracts to be in place. Our current vendor was technically up this month, and now we have a month-to-month agreement so that we can continue the existing patients, continue to bill people that are in the current system. But then we have to have a contract to be, which we already have authorization for the contract. It's not currently inked. It's at the county attorney's office right now to be able to move forward with a new vendor. But then we have 3 months worth of training before we can switch over. So hopefully by the time we're with the new vendor, it'll be streamlined and part of things, and I won't have to ask or, sign new contracts for EVV because it will maybe be a one-time fee. But for right now, the current one we're trying to get out of it. And other agencies are complaining about the same thing. And I think what
as soon
the
as you get it
fear.
figured out, they'll change the rules, so.
Right, and the fear, I mean, I am advocating to try to get Medicaid to streamline it by making either one aggregator or making EMRs have to only charge once. But those are things that are gonna be more long-term because they're not fixed yet. And they think that it might be too late to even address it in the current budget, but, with the state.
Of course.
So it's frustrating at best.
Good luck.
Yeah, that's true. Any other questions? All right, we'll vote on that then. All those in favor? Aye. Opposed? Carried. Thank you.
So now with our discussion items, we'll go over the financials. That's gonna be your attachment 7 and 8.
So attachment 7 was as of March 9th, and and also just a note, still 22 is not closed yet. We will be getting our preschool AVL is due in April for the fall of last year, so that'll be a good chunk of change. We're waiting for farmers market for the WIC program to see what kind of value that is when they gave out, because we record that value on our books. The other thing is in 2023, at least looking where we are currently, we're fairly consistent with last year. One thing to know, our salaries, again, at this point, we're 11.5% of our salaries budgeted. Where last year, the final, we were at 16.24% of the budget. So we're holding our own on that case. Attachment 8 is a comparison of last year at this time. And again, you'll see the salaries were above it, but overall part of budget we're consistent, not much in equipment yet. We're in the beginning of the year. Our contractuals are down a little bit, but again, that's due to timing of it, primarily when I looked at a preschool program, just getting those invoices in We work with Prospect primarily as our biggest vendor, but trying to get those in and then get those approved. And revenues are fairly, like I said, consistent, not a big difference with last year to this year at this time of year. One thing to know is in May, we're going to start with our rabies clinics again. We get a little bit of revenue from that. We're starting STD clinics, but that is a free thing, obviously, but those expenses related to those will be under our state aid, so we can bill for the time for our nurses, well, actually, not our nurses now, but nurses and time and what we have to spend for that. We are doing some COVID clinics still if need be, and I think flu clinics are pretty much almost over, but again, when it comes to that, we are no longer doing travel clinics, so those are slight revenues that we were getting in the past that we're not seeing anymore, but of course, we don't have the expense related to those either because we're not having any clinics there. That's all I've got.
Questions?
Pardon me.
Any questions? for
That's what I
Tom?
was going to say. Do any committee members have questions on like the financial report? No? Anything else, Tom? Or no?
No,
Well, I was gonna kind of just hit the highlights of our attachment since we had so many resolution requests.
Yeah,
and
that's-
Thank you for your support on all those.
Mhm.
Attached to our typical rabies report, we do have our rabies clinic schedule, if you want to put that up in your towns or
Mhm.
publicize that. And also our little information sheet that's usually on the back of that schedule, we included for
Mhm.
information. I added Quality Care Coalition in the ombudsman recruitment. There is an attachment, but you have a nice envelope filled with information. We've been getting some complaints, some concerns in the community with regard to some of our skilled nursing facilities. And I thought it was a nice time to kind of reorganize our Quality Senior Care Coalition. This was initially organized out of our Health Services Committee in 2019. And it was chaired by 3 people, Tammy as a representative from the administrator's office, Pete Parch from Office of the Aging, and myself from Health Services. Our first meeting was actually in May 14th of 2019. And we had a lot of really good community that participated in these meetings. At best, we had all 4 nursing homes or skilled nursing facilities that were included. And we actually rotated the meetings through their facilities, so it was kind of nice. Catholic Charities was involved, area medical providers, because a lot of times the medical providers or the medical directors like the medical facilities are the skilled nursing facilities. We had social services, we had RSVP volunteers, we had Conference Center, 4 Mountain Senior Citizens, in addition to all the senior centers like Glens Falls, Queensbury, etc. We also have general community members. We have Board of Supervisors representatives, Supervisor Driscoll, Supervisor Hogan, and our Health Services Chair, Supervisor Frazier, were part of that. It was a great group. The meetings are very well attended. It established vital relationships with people that worked with the senior population. And we actually created 3 brochures. One of them, and they're included in your packet, one of them was on selecting the appropriate home, because if your loved one goes to the wrong home to begin with and needs more services, you're setting yourself up for stress and failure and this, that, and whatever. So trying to help people choose the right facility up front. So our committee actually worked together to come up with this. We also came up with one on promoting healthy relationships between caregivers and skilled nursing homes, how to kind of set up that successful relationship when there's concerns or needs that, the right people to kind of go to and ask before it escalates into bigger issues. And then we did a sharks dispensing one, because a lot of seniors have a lot of meds and they get sharks and how to get rid of excess meds and stuff. Unfortunately, our last official meeting was March 17th of 2020 when we had our first COVID case in Warren County and we shifted to COVID. But our goals right now are to reorganize. Our first meeting is anticipated to be May of 2023. So if there's anybody that would like to be a part of that, we'd be more than happy. If you've got a senior center or you've got a representative in your community that you feel might, want to be part of that, please have them contact me. I'm happy to add them to that list. Even if they can't come to all the meetings, we would send the minutes out to the people that couldn't be there. So we're happy to do that. The biggest need is also to recruit an ombudsman. For those that might not know what an ombudsman is, that is a volunteer out of the community that receives some training. Right now, Catholic Charities has that training. And they would spend like 4 to 5 hours a week in the skilled nursing facility, just basically being that liaison between the residents, the families, and the administration. Throughout the pandemic, it was rough. One of our longstanding ombudsmen passed away. It was also a time where visitors weren't able to go into the nursing homes or skilled nursing facilities. And so, not that the program's been forgotten about, we do have one ombudsman that's in our community, primarily at the Warren Center right now. But Catholic Charities has done its best to try to provide that service in the interim. I spoke to Mary, she's out of Catholic Charities, and she's over that ombudsman's program. And they now have an ombudsman's program that is offered for training done by webinar. And so it's a little easier for volunteers to be a part of, because initially when our group met and we tried to have the ombudsman program and the training, you had to have a minimum of 4 people and it was in person and blah, blah, blah. Well, now, because it's more of a regional training, like another region could have 1 person, we could have 1 person, another region could have 1 person, but they could still offer the training online because they can get their 4 people throughout the whole state versus, just Warren County. So we're excited about that. We want to recruit that. So in your packets, I gave a handout that maybe you could post at towns or talk about at meetings. People, or you have concerned citizens, gave you a little bit of information on the ombudsman program. And I also gave you this cute little bookmark, but it's got kind of what the rights are of people in the nursing homes and skilled nursing facilities. So if anybody has any questions or concerns, I hate to take up too much time in this meeting, but it did kind of come out of here. Recently, there's been that need to kind of refurbish these relationships because there's been a lot of changes through the pandemic and our commitment to kind of restart that meeting up. So let me know if you've got any questions or concerns with that. Other exciting news, Public Health Week is April 3rd through 9th of 2023 this year. I have an attachment number 12 that's there. We're looking at people, we're going to be posting information on our website and through our social media. There's the handout on some ideas of what we could do. But one of the things our health educator program and Dan, our public health program manager, they sent an email to all the supervisors basically saying, we're trying to focus on community as bringing people back, getting people back engaged, going to the community resources like your farmers markets and, the different programs that you have within your community. So if any of the supervisors want to just do a quick tidbit or a quick little line, both Don Lehman and Dan have offered to help you and, help polish and wordsmith and whatever you would need help for. And they are both available after all the committee meetings today, tomorrow, and the rest of this week. Should anybody want to be part of a little video or be part of a flyer or be part of our website, just saying community means, and this is what I like, and this is how I think it affects public health. So just wanted to bring that to your attention and to thank Dan and Don for their efforts and trying to get that off the ground. Very exciting. Our STD clinic is back up and running. It never really officially stopped because we still were meeting the needs of the general population. If people called and they needed help, we were helping them on an individual one-on-one type thing, trying to kind of skirt through the chaotic COVID system to try to help their needs. During the pandemic, some of our nurses retired. Also, our providers retired. So it's been a long time coming, but we have a contract in place with Hudson Headwaters to provide us our provider for our clinic. This is a Warren, Washington collaboration. So Washington County is providing us the nurse, since we don't have a full-time nurse on our public health side right now, to do the clinic. And we also are collaborating with Ryan White to provide the HIV testing. So this clinic will be once a week. It's appointment only, just because by noon of Tuesday, we'll cancel the clinic and then start taking appointments for the following week. Historically, the clinic only met once a week in the evenings. We had overtime issues and costs and this, that, whatever, so we're trying to do it during the day now, and we're trying to do it appointment only, so we can easily call off the clinic and not incur expenses if we don't have anybody coming. So just wanted to bring that to your attention. We have this posted on our website and our social media. And we're up to meetings and conferences, unless anybody has any questions. We have 2 of our WIC staff are signed up to go to a breastfeeding coalition conference, March 27th. The cost is $80 per participant and will be fully funded by the WIC grant. Pat, our Assistant Director of Public Health, is going to be attending the New York State Public Health Association conference, April 25th through 27th. The fees of this are covered in our nice HO dues, but it is an overnight, I believe, in White Plains. And most of our WIC employees are going to be also participating in a virtual conference, April 18th through 20th. The conference is $150 per participant. And again, this is fully funded by the grant. So that was all I have. Thank you for your attention, and I can entertain any questions.
Well, I want to thank you for bringing all this information to us. I think this is wonderful. Supervisor Bruno.
Thank you, everyone. Just a question. I look at this rabies report regularly when I would get them. Perhaps, couple things. What do you see the response to the health clinic? These shots are free to people?
For the rabies clinic?
Yeah.
These are for animals.
Right.
And they are technically, well, we do human vaccine for rabies too.
Oh, okay.
We have post-exposure, so.
Okay.
This is for the animals. They are technically free. We have to, through state aid, have a minimum of 4 clinics a year.
Okay.
Historically, 1 a quarter is what we try to do. Actually, pre-pandemic, we were doing around 20 a year, where we were trying to kind of each month between February and November, go like 1 up county, 1 down, and whatever. Some of the participation was kind of starting to dwindle. Then we went through the pandemic, and now we have an issue trying to have vets cover the clinic. The 4 met the needs last year and the year before, so we can always add.
You get a pretty good response to these?
But they are free. We do get a good response. We do ask for a $10 donation, but nobody's turned away. And if we have somebody involved in an animal bite and the animal's not vaccinated, we actually refer them to our next clinic and tell them, hey, Janelle said it's free or no charge or whatever. It's free to begin with for everybody. We do ask for the donation, but we try to get the people that we know that the animals aren't vaccinated to kind of go with the hook of, please go to the clinic, we can serve you, but they are well attended.
The record here looks pretty good, as it does monthly, I think, either by luck or through this good program. I recall several years ago, rabies was quite an issue, maybe 5 years ago or so.
It's typically cyclical.
Yeah.
With the animals that are positive, and we did have our 1 bat that we tested that fortunately was negative.
Yeah. Surprised.
But
Okay, well, thank you very much.
All right, any other committee member have a question? Supervisor Runyon.
My question relates to the drugs. I have a resident who has some they want to dispose of. They don't know how. So what would I tell them to do? They want to get rid of old medications.
well, for this particular case, you can have them call me, but I just, from a personal note, was at my own pharmacy and saw empty bags right at the pharmacy counter
Oh,
that you can take and fill them, and then they either get mailed or dropped back off to the pharmacy. I don't know. I didn't look at it that closely, but I can research that and your person can call me. We
okay.
can also post that information on our website, but the sheriffs also have the ability to take medications. I think there's some restrictions like with needles or liquid or this, that, or whatever, but we can help.
So pharmacy or the sheriff, I'll reach
Yes.
out to them and say,
Yeah, well, and have them call me as well, because we can do.
okay.
Privilege of the floor, Supervisor.
Yeah,
Thank you.
thank you, Madam Chairwoman. I was called by a constituent this week whose mother is in the Warren Center, and they were very concerned on the level of care that was there. And without going into any detail, it wasn't a good level of care. So is this where an ombudsman would come in to help them? Okay,
And there is an ombudsman for the Warren Center right now, and I can give you that information.
okay, thank you. And if I may.
Yes.
More on the STDs and all, how are we doing as far as the national average and infection rates?
I would have to go back and research that, but even looking at the state and through COVID, unfortunately, I think a lot of people didn't get tested. I mean, people, if they were sick. Well, let's just back up. During COVID, you saw a lot of people that didn't go for their cancer screenings that were routine. They didn't go for elective things that might have made their quality of life better. They didn't get some of their chronic health conditions cared for. They didn't get tested for STDs. Not just because our clinic usually serves 0 to 2 people a clinic. So, I mean, we're not making a big dent in Warren County's clinic,
So,
but we do have to have that provision through a state aid requirement. But I think in general, all the STD numbers are down. They're actually out there.
mhm.
People just haven't been tested, so we kind of have to recharge that. And New York State right now is following a gonorrhea that's a little drug resistant to some drugs. It's not untreatable, it's just not treatable with common drugs that we're used to treating. So we're monitoring that as well, meaning if I was to get a gonorrhea case, I report that to the state as I usually do, but I kind of sound an extra bell so they can maybe test to see if that's a strain that needs additional medication.
Thank you.
But I think in general, all numbers are down, but they're out there.
Okay.
Don't know averages.
Supervisor Smith.
Yes, Mr. Chairman, just a real quick, general question. There's going to be an index to COVID in May 11th. So I'm not sure what that means. That means, well, it means a lot of federal aid is going to go away. Is there anything we need to do? Are we okay with that? Are our programs affected by that?
Well, one of the things I'm highly hoping will happen, as you notice, Tom and I still have our masks. We're still required in our office to wear them because we're in Article 28, which is a clinic. And we're in Article 36, which is a home care agency. So we're kind of double whammy with the requirement. Where the hospital and like federally qualified health centers can kind of get away with some of their administrative and their like fiscal staff not wearing, it's because they have certain sections of their office that are put off to their providers, like the nurses aren't walking through that area, that have the connection with the patients. Patients aren't walking through those areas, so they're able to do that. So our office, very open plan, everybody's commingled, so we have to continue to wear the mask. We have been working with the federally qualified health center and the hospital to come up with the same plan for removing the mask. For example, you might have known the state not too long ago put out guidance saying, oh, healthcare workers don't have to wear masks anymore. That was the headline attention grabber that everybody stopped at, but if you read in between the lines, it said that you had to follow the CDC guidance and you could be stricter, but you had to basically follow the minimal guidance, which meant if you had substantial or high transmission activity within your community, then you still had to wear masks. The thing, a little detail a lot of people didn't read, but what we've come together to say is, hey, when we're at a low for like a week, or I think we said 2 weeks, then we can maybe take the mask from our clinical staff, because you don't want to today, tomorrow, you want to kind of be sure you're leveled out. I'm hoping in May that will go away. So that's one thing that I'm really pushing and that we're pushing back on the state for is like everyone, like my staff could wear a mask in their office. They could go to lunch together and not wear a mask. What am I doing? The other thing is, if you remember, all healthcare workers had to be vaccinated and boosted. So if anything, I've got good vaccination rates in my department. So again, the math, we have screening, we still do temperature screening and symptom screening every day. So I would like to see a lot of that go away in May. One thing that's going to be a sticky wick, and this might be more of an HR personnel issue, is right now with our Warren County employees, they're paid like 5 days of COVID time because we don't want them here when they're infectious, right? And I believe there's a resolution for that, and I really am not up with the legal of it, but my understanding is it goes through December. So like if things get like relaxed in May, and like a county employee would have to stay home if they had the flu because they maybe were sick, we're now, are we gonna require them to stay home with COVID or not? Or, I mean, I'm obviously advocating that we for COVID in our thing, but that's something the county's gonna have to look at as far as from a personnel issue, because right now, if somebody in any of our county departments gets COVID, they're referred to HR in our office where we verify the result, or they go to their own doctor to get that result verified, and they get paid to stay home for 5 days because we don't want them spreading COVID. And then they should be coming back and wearing a mask for the remaining 5 days. Or in some situations, they might be like really sick or hospitalized or something. At that case, you know, we pay them more. But that's something that might have to be looked at after May.
Yeah, the state extended for, at least for private employers, the mandated vaccine leave and mandated paid COVID leave for at least 5 days. Yeah, until the end of the year.
Question?
Follow up if I may.
Yes, go ahead.
I think that index by the government is also going to affect the financing of the free COVID tests and the boosters and the shots, which may impact our susceptible and elderly population here. Just wondering if we had thought about that.
This is just a guess.
Okay.
Medicare will most likely be covering vaccine for our seniors, especially if we're encouraging it to go with the flu shot, or if the flu and the COVID are combined shots. You know, so I definitely know that if maybe somebody else that's uninsured has to pay, we usually have vaccine for children, vaccine for adult type programs that people qualify, and the vaccines are on that list to be able to cover. But my understanding is when that goes away, the price of the vaccines are gonna jack way up, and I don't know if insurance companies are gonna be mandated to cover them or not, especially if they're required in certain employment, you know, capacities, but worked out for sure. The testing, again, the test kits, it might not be as free and available as they are now. Maybe go back to the provider. I mean, you don't know if you have a flu or, you know, RSV or something unless you go to your doctor. You might have to go to your doctor for that kind of thing, but I think it does need to be normalized to some extent. I know our office would love the day that we don't have to mention COVID on a daily basis, because we're still calling cases that we're aware of.
I think we'll wrap this up at this point. If no one has any other questions, I'll entertain a motion to adjourn. Supervisor Smith. Right, Dan. Sorry. All those in favor?